Okay, here you are, Dr. Marchetti.
Hi, nice to meet you, Matteo. Nice to meet you to everybody.
Very pleased to see you also. Good morning, good evening, good afternoon for all of you. Please, Dr. Marchetti, can you put your webcam on so I can see you and share the presentation? Fantastic. So as I was saying, hello everyone. Thank you for being here. Again, you are a lot of people. There's a lot of people attending our series of webinars. So thank you very much for that. Today, our host is Dr. Francesco Marchetti, who will share with us his experience in reshaping and augmentation of the calves area using hyaluronic acid fillers. We hope, as usual, on the behalf of Bioscience, that you are all safe at home. The situation is starting to recover in some countries, for example, in Italy, and we really hope that these difficult times are finally coming to an end and will be behind us very soon. As you are used to it now, you can already send us all your questions through the small dialog box you have on your screen, and where you can write all your questions. As always, we'll try to answer as much demands as possible. In case we don't have the time, we'll take care to answer each of you by email. Trust me, we did that from the previous webinars, or during the next webinars proposed by Bioscience. Talking about it, Bioscience, as you know, is a German-born manufacturer of medical devices based on hyaluronic acid. Since 2001, we have been developing them for various medical fields: orthopedic, ophthalmology, dentistry, gynecology, and urology. And we started in the aesthetic industry in 2006. Bioscience has developed several range of hyaluronic acid products, and we can say that today we are the only brand in the world to offer a complete range of dermal fillers with different types of hyaluronic acid. Monophasic, as the one you saw during the presentation, if you were in the waiting room before that webinar, in two compositions, monodensified and polydensified, for the face, and a unique biphasic formula for face and body. That's the case for the brand that we will work on today, HiaCorp. Above all, and that's very important for us at Bioscience, all our products have the CE mark approval, the European Community approval for all of its facial and body fillers, and for all our brands. We are very proud of it, and we are registered in more than 7 countries all over the world, with more than 100 distributors managed from our offices in Germany, Madrid, and Dubai, and hopefully very soon in other countries, probably Brazil. But what interests us today is HiaCorp hyaluronic acid fillers for calf reshaping and augmentation. HiaCorp is our range of long-lasting dermal fillers designed for face and body. To obtain perfect results in face contouring, rejuvenation, and body augmentation, HiaCorp has been formulated with a defined particle size and a relevant concentration of hyaluronic acid that increase their duration and ensure the viscoelasticity of the gel. For those who haven't met it yet, in 2004, Dr. Francesco Marchetti had been admitted at the School of Specialization in Plastic and Reconstructive Surgery at the University of Rome, La Sapienza, in Italy, which he accomplished with a final score of 70 cum laude. After that, he would accomplish his doctorates in plastic surgery, dermatology, and human anatomy at the University of Rome, La Sapienza. Since years, he's traveling the world to train and educate several professionals in the field of plastic surgery. In fact, Dr. Marchetti has published a lot of scientific content. You can see the main ones here on the screen. And he's an eminent member of Bioscience Scientific Committee. Now, I leave you the floor, Dr. Marchetti.
Excuse me?
No, it's your turn.
Hi, good afternoon to everybody. I'm very pleased to stay here with you in these times. Here in Italy, things are going a little better now, so we restart doing something, talking about fillers, aesthetic medicine, and surgery. Today, we will talk a little bit about the HiaCorp MLF, because we will talk about the body contouring with the exception of calves. As we know, today, body contouring for calves indication, we have a lot of patients who are asking to us great numbers for body enlargement with fillers or surgery. Today, we know that Calves indication are for Calves reshaping and augmentation. Mainly, we can have three main approaches, like the surgery with implants, like surgery with fat transfer, or fillers. We can choose between these because of our experience, our knowledge, or our attitude. We know that for Calves reshaping, prostheses are actually used a lot, and we could choose between tailored implants or custom-made implants. But we all know that the calf augmentation surgery is not such an easy surgery, so the doctor has to be really skilled, because it's really a safe procedure in a skilled doctor's hand. We all know that the possible complication of surgery associated with implants are bleeding. We could have a lot of cases of infection or displacement. Sometimes we could also have asymmetry, because in placing the implants, if you are not so precise, you could have a lot of problem of also poor healing and really bad scarring. And also we can have the most important complication, the nerve damage, if we are not so accurate. In my practice, I got some surgery with implants, and I didn't have any big complication except bleeding one time. But I know that also in the literature is really one of the most frequent thing to have a reason surgery for implants. As we all know, also prostheses could be changed by lipofilling, that we know that is fat transfer. We could take fat from the abdomen or from the buttock, and it's always a surgical technique, as you all know, and it's also a technique that needs a high rate of sterility and also several passages in order to achieve the best purification for the tissue and also to achieve the best result. This kind of indication also can have some complication like inflammation and infection, and above all, the resorption rate, it's really high in time, and it depends a lot between diet, lifestyle, and physical activity. Usually after 1 year, we could have up to the 50, also 60% of the resorption of the entire fat that we had transferred during the surgery. Talking about calves augmentation with HA, what we can say is that it's really safe procedure. It's also a really fast procedure, always in skilled hand, because it's an office procedure. We don't need any general anesthesia. We could do it like for buttock or for liposuction defect reshaping, everything in local anesthesia. It's really less invasive than surgery. In fact, we are injecting the calves up to the fascia in the deep tissues, but not under the muscle. The learning curve is really small if we compare to the surgery. And also we have to say that, like all the injection with HA, is not permanent. So patient could decide if re-inject or not. The downtime is very little if we compare with surgery, and also the recovery is really fast. That is also really important if we compare the hyaluronic acid with surgery. If we compare injection of hyaluronic acid between the different area of the body, this area, the calves, it's one of the best, because also for the patient it requires really minor touch-ups, really less than the buttock. We know that a lot of filler during the time were proved. we know that in the past 30 years, volume fillers were experimented, but non-resorbable fillers like silicone, PMA, and oils. And after the first period of use and after the happiness of the first period, for sure, the doctors and we can read a lot of authors in literature who found that all these kind of material were toxic. That means that they are really too much aggressive for the tissues. This substance usually develop reaction like big infections. They can migrate very easily, and also they give a lot of inflammation. Here, now we can show some slides with, we can see here one calf injected with silicone that inflamed all the area of the injection and also the surrounding tissue. You can see down to the muscles, and you can see how it migrates in these little nodules. Here, after one complication of silicone, we have the removal of this toxic substance by squeezing it from a little cut that we can do in the area where we have the inflammation. Or sometimes we could have this kind of situation where we have big nodules that we cannot squeeze because they become like a sort of granuloma, and so we need a surgical removal with big scarring and a very bad compliance for the patient. This is one cases where calves was injected with silicone and with oil, excuse me, and we need to remove all the oil, made a lot of disinfectant and antibiotical irrigation, and then when all the situation became stable, we re-inject with hyaluronic acid. We all know that body fillers today is really much safer if we talk about hyaluronic acid. We all know that it became really very popular in aesthetic medical practice, except of all for the face injection. And but the big problem of HA is the fast and big resorption and also the rate of biocompatibility. The good thing is that also the learning curve required is really not high like surgery. Also is really less risky if we are talking about infection or complication. And also the learning curve could be little with high grade of satisfaction. What is not that easy to understand for the patient is sometimes the cost benefit in terms of injection keep with long lasting results instead of surgery. We know that, as we told before, that is really less invasive for body contouring, and we have a really minimum of dermal or subdermal scarring. One above all in the calves is the instant result that the patient can see at the end of the procedure. Sometimes we can show one side done and just to compare, let's see to the patient how big is the difference between the two calves, injected one and not injected. We know that the body filler are safe substances for the body. We don't have any sedation side effect because we go under local anesthesia. As I told you before, it's a repeatable procedure, so we can adjust the quantity for as patient needs or desires. Sometimes also doctor need or desire, and also is really reversible. Sometimes we could treat if we need and remove with hyaluronidase. The biggest difference between face filler and this body filler is the size of the molecules that we inject. In fact, we are talking about macromolecular filler. That is really important. Why? Because in good hands, if handled with a good technique, we can avoid the fast resorption and the side effect that usually HA could give. In fact, here we are talking about larger particles that are really much more stable to against the enzymatic degradation, and because the particles are for sure less exposed and has big volume for the resorption of the hyaluronidase. In fact, we are talking about particles of 500 Daltons. That is really more resistant. You can now make us a question that about the macromolecules that is maybe that is an acid and hyaluronic acid that could be really difficult to inject. But this is the focus of this amazing product, talking about Iocorp, is the thixotropic technology. This kind of technology is really a new technology designed precisely for macromolecular HA, and it lets to large particle to flow easily through the small needle. It is due to the new cross-linking effect of this kind of molecules. The thixotropic technology gives to this kind of tools a more durability. The chase is really more stable, and it's easier to inject. In fact, when we inject the gel, it becomes less viscous under our injecting force, that is the pressure. But as soon as it comes into the tissues, it will return immediately to the original viscosity that the gel has inside the syringes. This also means that this kind of gel is smooth and also is really long lasting in the tissues. It has also a covalent molecular binding that leads to a better duration and stability of this kind of product in the tissues, and it reduces the diffusion rates of the hyaluronidase. In the case of Calves, we are talking about injecting MLF1. Sometimes if we have enough space or the area is really wide, we can sometimes use also MLF2, but we have to be really careful in injecting it. This is the main difference between MLF1 and MLF2. You can see how the biggest difference is in the particle size, that the HA for MLF1 is up to 350 Daltons instead of the 500 Daltons of MLF2. We can see the biggest difference in particle size with the fillers of the face line. And also here it's really important because we can see how the increasing of the size of the molecule, we have an increasing for sure of the stabilization due to the cross-linking. We are talking about, like Matteo said before, about biphasic gel. That is a particular HA that consists in two phases. We have a cross-linked HA of a specific size that is suspended in a non-cross-linking HA that act like a carrier. And this particularity gives to this kind of hyaluronic acid a long duration and also give us really a best tool to use from the mid to the deep dermis. My personal experience is to have injected in the last year more than 2,000 syringes. So I don't have any big acute inflammatory response, just one that it solves in 2 weeks. But it came out after an injection of non-absorbable fillers hide in the area. I never had chronic inflammation like big granulomas or foreign body reaction. And sometimes you have, when you do the first consultation with the patient, it's important to talk to the patient and explain that if they have fever or viral diseases, sometimes the hyaluronic acid could have some inflammations that will go away as the fever or the viral disease go out. The rate of resorption, in my experience, is up to the 50% after 1.5 years or at least 2 years, for sure, lifestyle and exercise can affect the last of this kind of product. As we are part of the board of the bioscience, we are obliged to push you in to have the best experience with the product. But the best experience with this product is possible if we use the right approach with the correct injective technique, using for sure the best product. As Matteo underlined, this is really, really important because this is the only CE marked HA specific for treatment of the body. Usually, we suggest to treat the upper third of the calves, usually from the middle area to the lateral areas. It's never recommended for the lower third area of the calves, and the best and the biggest contraindication are if the patient has severe skin laxity, if we are in place with poor tissue covering, or if there's really a severe ptosis of the skin. We can assess this contraindication that I told you now with some little test that we do usually also if you are surgeon when we do implants for the breast, like the stretch test for laxity of the skin. We can use a caliper just to measure the laxity, and if we stretch this distance and the result is more than 50%, probably this is not a patient. This patient is not a good candidate for the treatment with caliper. The same thing is the laxity with the pinch. If we have to measure the skin fold that we have between our fingers, if the skin fold is less than 2 centimeters, maybe we have not the good coverage to inject with this kind of macromolecular HA. The treatment protocol it's quite the same that we use for buttocks or end, but it's really, really important to follow, because if we follow these little rules, we can have for sure amazing result. We know after obtaining the patient consent, we mark the treatment area in the standing up position. We clean with antiseptic. We inject with local anesthesia. Usually, we can inject only the entry points with a little pad, just where we start with the cannula. Usually, we inject the local anesthesia with 30G gauge. We do an entry point with an AG, the pink one, sharp needle, just to put the entry point. Then we inject either MLF1 or MLF2 deep in the subcutaneous tissue. In the case of calves, we are really up to the fascia. It's really, really dangerous to inject inside the muscle or under the muscle. Never do it. For injecting, we use an 18G 10 centimeter long cannula with the blunt tip. At the end of injecting, usually we inject at least 3 vials for the first treatment per side. I don't suggest you to inject more than 3 vials to avoid, and it's possible to have it, a compartment syndrome. At the end, we apply steroid strips on the entry point, and we fix like with fixation with adhesive bandages just for 3-4 days. Why using the 18G cannula and not the 14 or the 16? Because with this bigger cannula, we need, sometimes for the 14G, we need a suture in the incision. That is really, the compliance is less of the patient. If we inject with this kind of cannula, we could have migration from the incision, and also we could have the wrong quantity of HA injecting in each point, having a lot of probability to develop nodules or other lumps. Post-treatment indication are to avoid physical activity like gym or running up to 7 days to 7, maybe 10 days is better. Avoid to sit for a long time in the first 48 hours. You have to avoid for sure spa or similar areas for 10 days, and also painkillers can be used if necessary. We don't need in this area, because we are not injecting that big quantity, antibiotic or corticosteroid therapy. Usually we have this kind of medication only if we inject 10 vials in the buttocks per side. The transitory effect, like we have always when injecting hyaluronic acid, bruising, possible swelling, local inflammation. Sometimes we could have pain in the first 72 hours, and sometimes it's frequent also the itching. But all these effects could solve really in few days, maybe 5 to 7. We could have, as all the injection, some side effects that are ecchymosis, severe pain, big inflammation that could lead to big swelling. Also, we could have the formation of nodules that sometimes we have to treat with hyaluronidases. This is just to make you understand how is the best way to treat with this kind of fillers, is to treat really in the deep tissue, like you could see in the right side of our screen. You see we are below the scalp fascia, instead of the left side where we are really too superficial. In the left side, we will have some problem of lumps visible, and sometimes lumps that could lead to big inflammation and really severe pain for the patient. So really stay focused when inject this kind of molecules. Here is the ratio of the anatomy of the calves. You could see that you need to improve the upper part that have the upper 2/3 more than the lower part that is just the 1/3. The ideal filler candidate is the patient with undeveloped muscle, congenitally small calves, or that kind of patient that are really not responsive to targeted exercises. We have to exclude for sure patient with big vascular disease, patient with chronic diabetes, patient that could that are really easy to have infection, or as I told you before in my practice, try not to treat a patient that has previous treatment with permanent fillers. This is really, really important. We have to understand that we have to know which is the patient desire, but we have to match between patient needs and the doctor's suggestion. This is really, really important to achieve the best result in this kind of treatment. These are some little tips of the technique for calves injection. Here we can pinch the lateral and medial area of the calves just to understand how tight is the tissues and how deep we have to go. Then we can go inside with the 18G blood cannula, always checking with the top of our fingers where we are with the tip. We can start feeling the lateral compartment of the calf. Then we do the same thing from one more entry point that is lower above the area, always checking the tip. Really be careful, because in the medial area we have in the anatomy some little point to avoid, especially for because of the presence of the vessel. Sometimes if you are really a skilled doctor, you could also feel the upper compartment by one more entry point in the upper area that could shape really, that could shape better the upper part, but really be careful of in the entry point and in the depth of injections. Here we have some before and after. You could see how we shape from a thin calves to a really better shaped calves, both in the standing up position and during the movement. Why using cannula? We have to use cannula because this kind of procedure becomes and are becoming more popular. Because of the biggest success of this procedure, we have to provide to the patient the best experience with the least painful technique possible. Also because the cannula give us really the fewest complication in terms of bruising and ecchymosis. In fact, we have some advantages that could be less invasive because we have just one single entry point. We have the really less probability of bruising because there's no bleeding in the dermis that usually could lead to an hematoma, and for sure is less painful because the cannula is really flexible. The tip is rounded and virtually could give us a painless treatment. We have the perfect control of the injection depth, so we can really have an advantage talking about accuracy and effectiveness, and also both for us and the patient, we will be really more safer because there's the perfect balance between the flexibility and the rigidity. Now we will start with a video, and we will have the question.
Okay, thank you very much, Dr. Marchetti. I think it was a very clear and very well documented presentation. Thank you very much for that. We have already received some questions, so if you're okay, I will start asking you the question we are receiving. First of all, we have a question from Dr. Robin. He or she is asking if he can inject MLF1 under the muscle.
As I told during the presentation, my suggestion is not to inject under the muscle because it's not a safe technique. We have a lot of risk of HA embolism, like we could do with fat for sure. Also, this kind of tool is to inject in the soft tissues, deep soft tissues, but I can assure you that it's really enough to give projection and to shape in the right way the calves.
Okay, thank you, doctor. We have another question from Dr. Phillips from England, from UK. What quantity do you advise to inject on each of the sides for calves treatment?
Usually injecting with MLF1, we suggest to inject with at least 3 syringes per side. For sure, maybe the patient could require a touch-up that we could have at least in 1 month, or one syringe each side for sure. But as I told you in the presentation talking about complication, injecting more than 3 vials, that is more than 30 cc, could lead to have a compartment syndrome that is really a big issue.
Okay, we have received just right now a question from Fatih El Sawi. I think it's interesting for you to tell us about it. Why is it contraindicated to inject HiaCorp after a permanent filler? And if so, how long patient can wait or has to wait to be injected with HiaCorp?
Usually, this kind of situation is really hard because it's not safe, because if you inject on a permanent filler, you could have a lot of risk of lump and inflammation. You could have really a severe risk to have a big inflammation with also the formation of abscesses. And in my opinion, you could inject after removing all the permanent filler. After the removal, usually it's safe to give him a targeted antibiotic therapy. And then after 6 months, I think could be the time to inject with hyaluronic acid.
Okay, thank you very much, Dr. Marchetti. We received several questions about lower third. So, for example, Atef Alam or Mohamed Hassan are asking the same, more or less the same. Why it is not recommended to inject the hyaluronic acid into the lower third? And another question: what do you recommend in cases of infection?
Could you? I cannot hear you.
Let's start with the first one. Why can't we not inject in the lower third of the leg?
Because that kind of area usually has to be anatomically the thinnest area of the calves. So it's not also safe because you could have the risk to inject inside some vessel or eat some vessel. Okay, so if you are a skilled doctor, you could try to inject this area, but usually I'm talking about my experience. You could have only the need to inject this area if you have some defect from a previous liposuction. Usually you have to stay with the lower third thinner than the upper third.
One of these doctors is explaining that he received a lot of a good number of patients suffering from lower third legs wasting. So what do you recommend? I know we are a little bit out of hyaluronic acid maybe here, but because I think because we're receiving a lot of questions, what is the recommendation? Or what do you recommend to treat that kind of problem?
You can treat with hyaluronic acid. My recommendation is to use MLF1 in this area because you could be safer also if you're not so skilled in injecting. And you need really to look the patient every maybe 15 days just to give a little injection each consultation he comes. And after 2 or 3 times, you could for sure have the best result. Little quantity, but much time to inject, just or more treatment.
Okay, thank you, doctor. Shania is asking, can we use this product on face?
No. A lot of countries are now putting like a sign in the box where the distributor right is not to inject in the face because we are talking about macromolecules and you will have a lot of problem with resorption rate, with lumps, and this is one of the motivation why previous body fillers was banned from the market.
Okay, thank you very much, doctor. We received another question from Dr. Roselena Carrion from Ecuador. She's asking if she can inject hyaluronidase in the body 2 years after the original filler, because she has a patient who still contains the filler. So do you think she can inject hyaluronidase 2 years after the original filler?
You could try to use hyaluronidase to dissolve a little bit the filler. I got an experience with a patient who comes to my office and she had an echo scan after 2 years and we still have the filler in the right plane, in the right layer. And this is not bad because maybe the filler gives some fibrosis to the tissues, and then it's not really only the filler, but it's just a sort of new layer that creates after the injection. You could try to use hyaluronidase. Sometimes it's not effective. And at the end, if we are talking about nodule, because maybe the injection was too superficial, you could try to inject inside the nodules with the echo scan for sure, under the echo scan, corticosteroids.
Thank you, grazie mille. Another question from Dr. Abul Saud. He asking if he can dilute the MLF1 or MLF2 and what is the ratio?
We don't suggest to dilute the hyaluronic acid because you will for sure lose the sterility of the product, and also it could be really dangerous for the patient. I don't suggest anyone to dilute the filler. You don't need to dilute it. Maybe if you don't want to use, as I told you before, MLF2, you could use for sure MLF1, that is softer, and you could use less product in more treatment.
Okay,
But
thank you, Dr. Marchetti.
Or do things like this, because in this kind of treatments, the most important thing is the sterility. We can see that all the complications we have, giving out the technique, bad technique, is due to the sterility, infection, inflammation. So try not to mix anything. Try to be the more sterile possible, disinfecting in the best way, and don't manage the filler or syringes with other things that could really damage the sterility of the product.
Thank you, doctor. We received a lot of questions about the longevity, the duration of the product into the patient body. Just for you to know, I will answer that. For MLF2, for example, it depends. It always depends on patient, of a lot of factors. His health, if he's a smoker, his activity, a lot of things. But the treatment, I mean, MLF2 is a hyaluronic acid filler that can last up to 2 years after injection. Okay. I have another question for you, Dr. Marchetti. Dr. Calves from Mexico is asking if the patient can walk or exercise straight after the injection.
It's better not to do hard work or big exercises for 10 days at least, because exercises could affect the result, but also if you exercise as soon as you return to your routinary activity, you could give the possibility to start being inflammation, because you know you just injected, so you do an entry point, you stimulate inflammation with cannulas, with syringe, with the product inside. So the hyaluronic acid needs to become stable in the tissues at least for 7 days. 10 is really much better. We are also talking about going to disco in the night, for sure. It's a sort of activity.
Okay, let's keep that for another webinar, maybe a longer one. Next question, Dr. Marchetti from Sasan Abbasi. He or she is asking if we inject MLF1, if it's possible to inject MLF1 suprapriostal for cheek.
For cheek? No. We are talking about not injecting face in any way. In any way, really, it's I saw something going around the world, and I saw a lot of complication after really also several months. That is really dangerous, and sometimes the only possibility to solve it is to have surgery, to remove it by surgery.
Okay. Another question from Dr. Zago. He asking if he can use MLF2 for calves as well.
It depends if you have a wide area, and also if you have maybe, you know, also another real toxic, but the skin quality is good, so you have a good coverage, and maybe it's a little empty. Sometimes you could have in when you have a big loss of weight in some patient, you could do really deep up to the fascia, always in the subcutaneous tissues, and then shaping the superficial part with MLF1. But the suggestion is to inject maybe with one more syringe of MLF1.
Okay. Thank you very much, Dr. Marchetti. Again, I will repeat that because we have a lot of questions about the duration of IACORP MLF1 or MLF2. It's up to 2 years. I repeat, the exact duration will always be depending on several factors. For example, patient's metabolism and lifestyle. But the quantity of product injecting and the injection site are also factors that we have to take into account. But it's up to 2 years. I think we answered all the questions. Oh, no, one more question from Mohamed Hassan. Can we use IACORP in dorsum of hand, cannula size?
In dorsum of the hands?
Yeah.
If we are talking about MLF1, well, yes, we can use it. And my suggestion is to use maybe one syringe shared by the two hands at the beginning. And then after 1 month and 15 days, we could have a touch-up with maybe half of one more syringes. But on the ends, it's really the best product to use is the MLF1, because you need a softer product for sure.
Okay, thank you very much. I think we answered all the questions. Thank you very much, Dr. Marchetti. Thank you very much to all of you, because you were a lot of people attending that webinar again. Please stay tuned to our channels, because we will announce the next webinars for IACORP and probably IAPROF also. We are starting to develop some webinars in local language. We did Spanish, we will have Italian probably very soon. Probably Portuguese also, so we will keep you informed. But thank you all very, very much for your attendance. Thank you for being here. Stay tuned, and we will come back to you very soon. Thank you, Dr. Marchetti, and have a nice afternoon.
Thank you. Have a nice afternoon to everybody. Bye.
Ciao, Francesco. Grazie mille.
Ciao, ciao, Matteo.